From the PEP Radio Newsroom, this is the hourly news blast, and our apologies up front for this being a very long recording. LGBTQ Nation is reporting the British Medical Association, or BMA, the trade union for doctors and medical students in the United Kingdom, has voiced its support for the controversial Cass review of gender-affirming care, formally dropping its previous opposition to the review and to Cass's recommendations. Dr. Hilary Cass has been vindicated in the way she approached the data. The lead of BMA's review and chair of its Board of Science, Professor David Strain, told The Times. Strain claimed that Cass approached an area of significant uncertainty with that prime rule of medicine of first, do no harm. When asked if she could name a single recommendation from the review that he opposed, he responded, "I can't." The Cass Review, first published in April 2024, enraged trans advocates by pushing for treatment of trans youth to move away from medical intervention in favor of a more holistic approach. Cass recommended therapy, suggesting the need for treatment of coexisting mental illness, as well as examining potential neurodivergence or family issues. This is all just fancy talk for conversion therapy. The medical form of gender-affirming care that Cass recommends moving away from is supported by all major U.S. medical associations. That treatment, which has been deemed safe and, in many cases, reversible, has been linked to reduced rates of depression, anxiety, and suicide attempts in trans youth. BMA originally opposed the Cass review with strong language saying the findings were unsubstantiated, announcing its plan to publicly critique the Cass review in July 2024, BMA noted. Doctors and academics in several countries, including the UK, voiced concern about weaknesses in the methodologies used in the review and problems arising from the implementation of some of the recommendations. But BMA reversed course on that position this week. 12 members who have been kept anonymous for stated security concerns have said that the evidence base for puberty suppression and gender-affirming hormones is limited and uncertain, according to the British Medical Journal, which is owned by BMA, a shift which is not substantiated by the science. The review supported the findings of the original landmark review into gender identity services for young people. BMA's report, which was originally scheduled to be released in January 2025, ended up taking almost 2 years after significant delays. The review was led by Professor David Strain of the University of Exeter Medical School, who works with older adults and focuses on diabetes treatment. Diabetes, not gender affirmation. He studies and is educated about the pancreas, not gender dysphoria. In a statement in 2024, when the review was announced, he noted that he did not treat children and young people for gender dysphoria. In other words, he doesn't know what he's talking about. While he claimed that the first phase of the review would be to listen to people with lived experience, it is unclear who those people were or what experiences they might have had. Discussions of gender-affirming care in the United Kingdom have often focused primarily on the vanishingly small number of detransitioners, with that direction being championed by anti-trans advocates such as J.K. Rowling and Maya Forstater. The original Cass review has been criticized for failing to include trans advocacy groups until late in the process, and while Cass interviewed at least 1,000 young people about their lived experience, she said that their views had to be balanced with the perspectives of clinicians and academics. In other words, idiots like she is. While BMA has dropped its opposition, it has maintained its criticism of the United Kingdom's ban on puberty blockers. The legislation for the ban was introduced by Wes Streeting, Secretary of State for Health and Social Care of the United Kingdom in 2024, following the release of the Cass review, but BMA believes the move went beyond Cass's recommendations. You're damn right it did. BMA still feels that puberty blockers should not be widely prescribed to trans youth, but that the decision should be made by doctors, its stance being more related to government overreach. The group announced it is continuing to oppose a ban on puberty blockers for several reasons, not at least because it is a threat to the autonomy of a physician. We spend decades training on how to use drugs, and to have political decisions affecting the way we prescribe is wrong. The same applies to bigoted physician groups like the BMA. An NHS trial for puberty blockers has been recommended by Cass to get a better understanding of how they work and their long-term effects, but no doubt she would screw that up too. And that was due to start in January of this year, but it was put on hold after people raised concerns about long-term biological harms. Now, this is the part that royally gets me. Do you hear this, King Charles? Cis children who suffer from precocious puberty in the United Kingdom are exempt from the ban on puberty blockers. This doesn't apply to cisgender children, only trans youth. Bullshit. This article mentions suicide. If you need to talk to someone now, call the Trans Lifeline at 1-877-565-8860. It's staffed by trans people for trans people. The Trevor Project provides a safe, judgment-free place to talk for LGBTQ plus youth. At 1-866-488-7386, you can find these numbers on the Pennsylvania Equality Project website, paequality.com. You can also call the National Suicide Prevention Lifeline here in the United States, not the United Kingdom, at 1-800-273-8255. That's a news blast for this hour. Up next, we have the Meadville area weather forecast right here on PEP Radio.